Hi, everybody, and welcome back to Vet Rehabbers from around the world. It is good to see you. We have got Kiki Haeusler joining us from Germany this week. How amazing is that? Hi, Kiki.
Hey, Donna, how are you? Hi out there.
I'm fine, thank you. Kiki, would you like to introduce yourself? I mean, your reputation precedes you, so please, give us the lowdown.
Well, my name is Kiki Haeusler. I'm from Germany. I'm from the south of Germany. It's Stuttgart, where a lot of car companies come from. So people might know it because of that. I've been a vet rehabber for about, almost 15 years. I certified as a CCRP. And ever since, I am working in my own little practice. Before that, I did my studies in animal science, and I did my diploma and my PhD in animal behavior. So I kind of like have a not very straight path, but I have seen a lot of things and have done a lot of things. So yes, that's kind of like me.
That's amazing. That's amazing. And I want to give the high five to the 15 years because that's how long I've been doing it. So I'm just thinking like, whoa, that's so weird. We qualified like the same time. How
Yeah.
bizarre. So and I have to say as well, your accent is incredible. I can't tell that you're German at all. How amazing is that? You've got such good English. It's impressive.
Yeah, I was very fortunate that my parents moved to the U.S. when I was 1.5, so I kind of like grew up bilingual for 3 years, and then we moved back. And I was so serious about not to speak German, but it didn't work out. At least I
Wow.
saved the English a little bit. Yes.
That's amazing though, and quite a decision to make at such a young age.
Yes.
Well done you. So how come you moved back to Germany? Was what was better about Germany than America? I wouldn't know.
Well, it was just an assignee, or he was an assignee with IBM, so he moved back after those 3 years. And since we're from Germany, I think that's why they just ended up back in Germany.
That's fair enough. So I just wanted to give a quick shout out to all the audience. Please make sure you do take this opportunity to ask questions because it's amazing to have Kiki on board and she's right here and available. So ask away. So Kiki, obviously you've just said when you became a vet rehabber, so that's amazing. So it's been quite a journey. You've obviously been 15 years, is a long time to be doing the same job. So that's really good. You obviously still love it.
I do. I
That's
do.
amazing. So what made you decide to change over to the rehab side of things? Obviously from, behavior to rehab. I mean, it's all still animals, but there's a big difference.
Well, since I didn't study veterinary medicine, I kind of like tried to find my way back. So I did all my internships during my studies at the either a veterinary clinic or a vet just around the corner. And then I started doing a lot of sports while I was studying. And so I had a lot of my own injuries because I played the European handball. So my knees, I have cruciate ligament ruptures on both knees. My shoulders messed up. So I did a lot of physio as well. And I kind of like thought, okay, there is an opportunity. And it seems like animals seem to suffer almost the same way we do. So basically, being a moving person, I said, well, I'm going to go into rehab and I'm going to do, the CCRP and see and try to get myself set up for a physio practice. Yes. And being a behavior person as well, it doesn't harm you because
It's
I
good.
mean, it works with dogs, and I did my PhD with chicken. So, yes, so I kind of like taught them how to use a machine and, pick at the machine and get something presented. So I taught 26 chicken how to do that. So teaching chicken helps.
That's amazing. That's absolutely amazing. I can definitely see how behaviour complements with the rehab, but also to point out that I definitely agree with the body awareness. And like, so I do a lot of sport as well, and you're just so body aware that you can just see how things move, see how things should move, how you've done things wrong and differently as a result of something that hurt, and it really helps you translate things, across animals and people, and just be able to have the conversation in human terms, when you're sort of saying, oh, I understand why your dog's doing this now, imagine it was on you, which is quite helpful. And I do understand that handball is ridiculously popular in Germany, isn't it?
It is, yes.
So yes. No doubt you're all in good company. So Barbara has jumped on and she says, hello everyone, with greetings from Switzerland. I'm looking forward to this conversation. Thank you, Barbara. That's really kind of you. So yes, me too. I'm so excited.
Hi, Barbara.
So how are you finding being a rehabber?
I think I really, really enjoy being a rehabber. Sometimes I'm frustrated, and sometimes I'm really happy, and sometimes it's just like an everyday job, and we have our routines. So, but it's a mixture of all of it. And since I am my own boss, I can do what I started doing, going back into research, doing some teaching sometimes. I do, quite a few things, and I really enjoy doing that and having the freedom of choosing what I want to do. Yes.
I was going to say, the variety is definitely what keeps it fun and fresh, isn't it? And you've just touched on your research there, so I'm going to just swoop straight down in on the research front. So, how are you enjoying doing your research? How do you find it? Do you love it?
I absolutely love it. I got out of research after doing my PhD because I was kind of fed up being at the uni and having those strict, you have to do this and don't do that. And, some professors or some scientists might put you in one position and you're not very open as a PhD student. So I was happy to get into the working field after being in the thinking field, maybe. But then I kind of felt the need that this field, especially the rehab field and the animal or in the veterinary world, does lack a little bit of research and a little bit of data, and maybe not so much on the scientific field, like from the unis, but from the clinical field. So I happened to use a shockwave device, and the company asked me to get into contact with the University of Cambridge, which was a huge opportunity for me. And once I got back to that world, I was like, yeah, I have to do that because it's so much fun, to find out if what you're doing actually works and how it works. So, and I think it's very, 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 very important for us. And that's, I'm going to have, the discussion group on the Rehab Summit, and I have a little talk on it. And I'm very passionate about that. Yes.
I will be there eagerly awaiting. I completely agree with you. I'm desperate to do more research myself because I think that it is really important. And of course, it's one of the things that evidence-based practice, it comes up all the time. That's the sentence that's constantly used. And and I agree completely. But obviously, you can only have the evidence as much as you've got the evidence. So, and we know what we see, and we do think it's awesome. But it's amazing to have that piece of paper that's saying, no, I proved it. I've definitely proved it. So, I think that's really good. And I know that a lot of vets would be so happy to have that, really strong, firm evidence as well. And it's, it's a proper minefield. It's a lot to get your head around. It's not to even read a paper, isn't it? But
yes, it is.
Yeah, that's really, really good. So very exciting stuff. And it's great to know that there's somebody who is so passionate about research out there, getting the numbers of research papers up. Because obviously it's, there's not enough yet. We need like literally hundreds of thousands of papers, don't we?
Yes. And I think it's really important to not be like disencouraged, or, you know, if you talk to people and they say, well, you need to, you know, get a lot of data together. And that's basically why we're having that discussion group as well, is to encourage everybody working in the clinical field to add to our field and, you know, gather some data, even through a questionnaire. You know, we have standardized questionnaires. You can make up your own. If you have enough people answering those questionnaires, you do have your data. If you use goniometers or whatever device you have, or, you know, you always do the same exercise to figure out if what you've done, your treatment worked out. We need to encourage our fields to contribute to the research, and, you know, get a lot more of teamwork out there.
Yes, that's what I was
And,
going to say, collaboration.
yeah, it's collaboration. And I know that there's a lot of like in Germany, you know, it's like, yeah, well, but, you know, we're not fluent in English. And I don't think that matters. You know, if you're passionate about something, you will get together anyway, and you will find out a way to work together. So I try to encourage, and I try to get people to share what they do and not just keep it to you, because it's very important for all our clients. I mean, all of us have some, you know, some talent or know something better than somebody else. And that's not, you're not supposed to keep it to yourself. You have to share that, because if it's important, if it's good, you need to spread the word. And if you can feed it with data, it's even better. So yeah, that would be my goal. And because you said, you know, make a difference. I mean, we all can make a difference if we want to. And I think that's basically what we have to do, I'd say.
Definitely. No, that's amazing. It's really lovely and very inspirational as well. So come on, guys, if you're all feeling inspired now, drop us a message, because I think Kiki would love to know who she's managing to inspire today. So that's really good. And how is it in Germany with regard to physio? Are the vets on board with it, or do they think it's witchcraft, or is there a bit of a mix? So there's a growing change?
Well, being in the field for such a long time, I've seen a lot of change, and I've seen a lot of progress in the field and working together with the vets. It is a bit different in Germany because we are not really regulated. There is a wide variety of people doing physiotherapy, and I think it's a bit different. So if I talk to people around the world, it seems every country is a little bit different. You know, even some states are different, like in the U.S. and states, you know, in Germany, they're different. They're different regulations, but so that makes it challenging. But I think if people are really interested and really are out there and, you know, show what they're doing, talking to the vets, it is well respected now, and it gets it's improving. So we see a lot of clients that get sent by the veterinarians. There is hearsay, and, you know, you should go there and do this or that with, you know, when they chat on their walks. But I would say it's almost now where we get more clients from vets than, you know, referrals from other owners.
Good. That's really positive. That's
Yes.
very, very good news. Excellent. So Barbara has also jumped on, and this will be to do with our previous discussion. She says, yes, exactly. The more we share our knowledge, the more we think outside the box, and the better we become. I completely agree, Barbara. So thank you so much for sharing that. I also think I should probably jump in and make sure I ask these questions, because so I did a question out before we did our interview to ask if anybody had any questions for you. And Marianne said, what do you suggest for exercise to help recover from a bad hip and knee? Now, I understand there is not a lot of context to go with there, but I thought I must ask the question that's been put forward, and just see what you want to say to that.
Well, that's a bit of a broad question. So if you don't see the dog and if you don't, or the cat, who knows, I can't really answer that on the spot. And I think it would be not helpful to say, well, I would do this or that exercise, not being able to palpate the dog or a cat or see it, or is it post-surgery? There's a lot of things we have to consider. And a lot of times you can't really follow one certain protocol. So this is something I learned from having the gait analysis machine or treadmill in my clinic. And it's been 3 years. I just had a reminder today that it's 3 years that we have the machine in the clinic, or the treadmill in the clinic. And I can tell you, having certain routines you would use on one dog doesn't work on other dogs exactly the same way. So I would definitely try to improve range of motion, see if you could do it passively, but a lot of things I would go to doing it actively and having the patient see what he's capable or she's capable to do, and then add up to that. And being in the very fortunate position of having that treadmill in the clinic, I can do my follow-ups pretty accurately. So I always have the same setup. So the dogs get on that machine. We even had cats on the treadmill. So some do walk on the treadmill. So we basically have the numbers and see if what we're doing works out. So yeah, I'm very lucky.
No, that's excellent answer. And yeah, I mean, it's exactly right. Every patient's different, and you don't know really what the injury is or anything like that, and you don't want to exasperate it by the wrong exercises. So I think the best thing to take from that is to contact your local rehabber and get an exercise plan that's designed specifically for your animal, and then that program will be tailored for their recovery as well, because equally, one dog's recovery 1 week later is amazing compared to another one, and that's just bodies for you, isn't it? They all are different on healing and all sorts of things. So yeah, well answered. So Mel also wants to know, what is the current research on core exercises and strength stretches, that sort of thing at the moment? Another broad question.
It is a broad question, and I really started searching PubMed and looking at the certain databases, and there's not much research out there. There's a lot of we have a lot of exercises out there which we use, but there are quite a few, and they're not specifically using a certain exercises. At least I'm not aware of any research being out there, but there are there's some literature out there that considers how they did some EMG on some muscles and tried to figure out how that works out, or with certain restrictions, how those muscles don't fire as much. So, but I just encourage everybody to get out there and get their protocol, what they're doing, and follow that up and get the data out there. And we can, easily, if we have a database, and people doing certain exercises, we can get together, share the data, and then write a paper about it. So if there's anybody out there and keen to do that and has a protocol, just join on Saturday and we'll work on that. So I'd be happy to help in any kind of way to get some research out there. There are some pilot studies, but you need a specific amount of clients and patients to get certain numbers out there. So, I mean, there's some data out there on, carrying dummies and how that works on the body. We did a little study out here and we're trying to publish it, but, we got COVID came in our way. So
yeah, that's really rubbish.
So we looked at, how does that affect the dog if it, carries a dummy, and how does it work on the center of pressure? So, and that would be something I would be looking for. So how stable? Does it change their center of pressure? But yeah, I encourage everybody to just step into the field or contact me. And, if you have a certain idea, I'd be happy. If there's anything I can do, I'd be really happy to help.
Oh, lovely. Thank you for that, Kiki. So Barbara has also said this. I put it on the screen so you can read it as well. Today I had a request from a veterinarian friend. At what time post-operatively the dog can use the underwater treadmill after a total hip replacement? My answer was right after the wound closed, but such patients usually don't come until the 12th week. So...
Yes, that's a huge problem. I mean, the veterinarians I work with now, so they're pretty good in sending them as early as possible. 12 weeks is good for your business because you're going to keep them forever, but not good for your client. I mean, looking at the human field, when they start, physical therapy, that's immediately post-op. So why would we start, after 12 weeks? There is no, at least to my knowledge, no evidence there that a dog needs 12 weeks until it can go into the underwater treadmill. I mean, being less loaded, I don't know what the point in that is, and I can't answer. I don't have an explanation for that other than we just do it that way.
Yeah. I have to say, it's one thing I definitely notice is things wait too long before they're sent, and that is quite disappointing, isn't it? Because sometimes you're just really pulling your hair out because you think, God, if I'd have had that a few weeks ago. So yeah, it is frustrating. That sounds like that's a very global problem then, that one.
Yes.
Oh,
I think that's a pretty international problem.
Yeah.
And I think it goes back to so with the steps, or if you're going up and down stairs, seems to harm the hip of a dog, which nobody can prove, but nobody can, how would you, manage to have a study to prove that that's not true? That's always the argument that you get if you say, well, but if you deal with stairs in your everyday life, why are you supposed to be able to walk upstairs when you're 8 or 12 or 10 months old, or your owner is not capable of carrying you anymore? So I can't wrap my head around that. That's saying, so we don't know.
It's exactly, and it just comes back to we need to do research, doesn't it?
Yes.
So what are the most commonly, I'm just going back to the whole Germany thing now. I want to know more about Germany. So what's the most commonly owned pets in Germany?
I think it's cats and dogs.
Still cats and dogs.
It's even more cats and dogs now.
And are the dogs, I mean, it's easier, smaller. Are they, do they do a lot of like working stuff in Germany as well? Like, are you, spit it out. Do you have a lot of agility dogs and sort of doing, any sort of fun sports, or, is there a specific fun sport they tend to do, or are they just much more pet dogs and don't do a lot?
Well, I think it depends on the clinic you have. So we see a lot of, I would say, pet dogs. We do have some police dogs, and we see some agility dogs, but we're not into the sporting. So we're post-op and neurologic cases. We do see, because of the treadmill now, we do see a lot of puppies now and growing dogs, because we are specifically into the field where we want to know how their gait changes and how it improves and how their center of pressure moves, and how specific dogs are probably better do this sport or that sport, or looking at that. But actually we don't really know. There is some knowledge out there, but not that much, so that's what we're looking for as well. So I think we're basically, agility is huge, but there's a lot of, obedience and obedience rallies and Canicross is getting very popular, so I think there's a lot of activities for dogs out there. So they're not just couch potatoes, but there are quite some.
That's good. So David has also jumped in and said, what can I do to encourage a dog to walk or run on a treadmill? I have a lazy but fully fit Whippet who will only use her front legs, and does the same with swimming.
So working on the treadmill, I can almost, I mean, there are some dogs that don't walk on the treadmill, but once they get into the flow, it seems like with people, and it seems like I don't like to go running, but once you've did it for quite some times, then you kind of like feel comfortable with it. So I think you have to find something that motivates the dog to get on the treadmill, and then just do small steps. Small steps, not just put it on the treadmill and just have it run. And sometimes what happens with a treadmill is, and what I can see now from using it for such a long time, is that dogs do feel more comfortable not just walking, because walking is not their speed of movement, which they would use for traveling. Yeah. So once you get them to trotting or at a faster trot where they feel comfortable, they will walk for a longer or run for a longer time than, walking is probably not the speed they would choose. But they have to with us most of the time.
Yeah, that is interesting. So thank you for that. That is very good. So with owners, do you have pet insurance over there? And are they quite keen to sort of pay, for this sort of holistic treatment, or are they much more focused on just do the vets, that'll do it, bare minimum?
That has changed over the time, I'd say. We do have companies now that cover a lot of post-op. There are very few that cover something or physiotherapy just for the physiotherapy. If you have a kind of like a dog that needs to be somehow adjusted, or it needs to work on gait, there are very few companies that cover. But it has changed. I think it's not kind of like where you are in the UK.
Ours isn't perfect either.
But we're getting there, I guess. And because the bills at the vet clinics are climbing, people are starting to have those insurance companies step in for them.
That's helpful. That's good.
Yes.
So Martina says, thank you for joining us, Martina. She says, hello from Poland. Hi, Poland. I'm a graduate in animal rehab, currently looking for an interesting topic to do my PhD. Thanks for the live. It's really interesting to get to know other people's insight. You're very welcome, Martina. And Kiki, that's amazing that she's looking for a topic. I feel like, oh my God, the list is so huge. How do you whittle it down?
Yes. I mean, the list is huge, but you have to find something where you can really gather data and get the PhD out. So, I mean, I know a lot of times, and I do post some things about doing research, but it's very time consuming, especially if you do it like I said, doing it as a hobby, paying for most of my expenses. Well, you have to really dive into it, and then you have to spend a lot of time and, have to sit down and read papers and think about it and put it into words. So it's not just the idea of doing something, but trying to finalize that. It's a huge effort, and I don't want to scare off people because it's massive fun, especially if you work in a team. And the teams I work with, I really, really enjoy working with them. So it's not work for me. So it doesn't matter if it takes us hours and hours to do it, but you have to find a topic you're very passionate about, not just, at least I wouldn't do that, have a topic and you can't relate to it. So yeah, you really have to pick that very carefully.
Yeah, I definitely agree with that. And it's funny because over the years, my ideas have changed and evolved. And I used to want to do more research on electrotherapies, but then I have to say my head kind of exploded because there's so many of them. I was like, where do you draw the line, you know? And then I might as well, and now I'm much more focused on pain, and so that's much more interesting for me. But it's, you know, it's interesting how that all evolves for you, isn't it? So
Yes.
good luck, Martina. I really, really hope that you do well. And please keep me posted. Please let us know when you actually have completed your PhD as well. And equally, you know, keep reaching out, because, you know, you never know what help you can get globally from everybody that wants to help out too. So I hope you're on the online pet health portal as well, because there's tons of people out there to help you if you are. Kiki, I am really aware that I've got like half a page more questions, and you've got to go and collect your child. so I've really, really enjoyed this talk, and but I feel really mean, so I feel like I can't keep you anymore. But thank you so much, and maybe I'll grab you again and find out more about Germany and rehab over there, and probably more about research, because it's just so incredibly interesting. But I think I've definitely concluded that we do still, yet again, I've found another country with very similar,
Yes.
you know, no matter where I speak to in the country, it's all really quite similar. But it's really nice to know as well, because I sort of feel like, you know, it makes us all able to be the same and work the same, and, you know, it's just lovely. So yeah, so thank you very much, Kiki. Can I just quickly grab your top tip for pain?
I would say there are two major components we use, and one is talking to the owners a lot. So it's not just the medication and just so it's medication, and it's a lot of times we have owners that are very unsure of what they're doing and how massively their dog or their cat is affected by pain. And sometimes we figure out that it's not the pain, it's more being, you know, very cautious and not doing this or that and not trying to do something. So I think pain is, if you ask the owner, well, how, on a scale from 1 to 10, what's the pain? And they're like, well, I'd say 10. And it's like, yep, but how would you, you know, put it into words, or what happens? And so they sometimes don't know what pain is. So, you know, you can have a limping dog and it's just a mechanical issue. So it's not that much of a pain issue. So I have a dog with a shorter leg and he's not in pain. He runs around, but he's limping.
Yeah.
So there's a wide variety. So we always, in terms of pain, and if I have clients coming in which are referred because of pain, we have a conservative pain management with a pulse magnetic field machine, which works really well on that. But I always have a questionnaire, a pain questionnaire, and I will go through that and I will ask them specific questions and then figure out if it's really pain or if it's more being afraid of something or having seen an x-ray looking really bad, but actually it's not moving bad. So I think that's it's not easy to answer.
But understanding it is the key. It sounds like
Yes.
you're saying you have to understand the pain, and that will help you understand your path of where to go to deal with it.
Yes.
Yeah, I completely
It's much
agree.
easier, you know, if you see, well, you can see, you know, if a dog's or a cat's really in pain, you can see it. There's
Yeah,
no way around it. But if you have a dog coming in like kind of like happy but limping, so it might be in pain, but it's not as severe as, you know, as the owner might think. So we go through specific questions and, you know, then try to figure out how severe that pain is. It a chronic? Is it an acute? Is it? So, I mean, you can cut yourself on a piece of paper and it hurts tremendously, but it's not bad and it's going to go away. So yeah, that's kind of like what we try to figure out.
yeah, it's very pain is definitely complicated. No two ways about that. Very complicated. Well, thank you so much again, Kiki. It's been lovely to have you, and I'm going to let you go. And yeah, I can't wait to see you on Saturday.
Yes, yes. You all need to be there on Saturday. I'm so happy. Let's have a discussion about research, and you're back. So now I have to jump on the bike and collect my kid.
Thank you so much. Take care.
Okay.
Bye-bye.
Thank you. Bye.